got modern 21st century primary care facilities here, and there's literally just about everything that the local population needs.
It's been 5 years hard work, but well worth it.
It's just what every community really needs.
Redcar's new £30 million primary care hospital is a local hospital providing local care for local people. In an area hit by thousands of job losses, it also represents a major investment in the community.
We've involved all our partners here, all the clinical services, our 4 new general practices, and it's been a very, very worthwhile project, and we now hope that the public of Redcar and surrounding areas will have a lot of use and a lot of benefit out of this new facility. You do get nervous, particularly during the first sort of 6 to 9 months, where there's just so many people on site and so many people doing different things, and you almost think, well, will it ever be complete? But we have the finished product here, and I can only say it's a really wonderful facility to have.
Long before the hospital was built, health professionals held discussions with the architect, Space Architecture, about what would be required for their patients and themselves.
I've been involved with it for the past 5 years, really. All the team have been heavily involved in the planning, you know, where the rooms were to be, what we wanted, and you know, what was best for our clientele, for our patients.
Jan runs the InPatient ward, which has 32 single ensuite bedrooms for its patients.
We didn't want it to feel like a hospital at all. We wanted it to feel like almost an extension of the patient's home. We often get confused patients in, and if it's a starkly clinical area, it freaks them out, makes them feel very uncomfortable. And coupled with the palliative care side of it, we really wanted it to have a homely feel.
Redcar's primary care hospital also features a number of other patient services, all under one roof. These include an urgent care unit, a physiotherapy department with rehab gym and hydrotherapy pool, a day hospital and pharmacy, an endoscopy suite and day theatre, and 4 GP practices. It all means that the people of Redcar are now provided with an integrated service.
Yesterday I saw the benefits of that because one of our patients came in and I was able to direct them across the building, and they were able to self-refer to the physiotherapist and were seen immediately. So big benefit really. Generally speaking, you'd maybe wait weeks to see the physiotherapist, so that was a good outcome.
Alongside this, the hospital has been designed to create a feeling of well-being and calm.
The architects involved in the scheme, Space, were absolutely brilliant in terms of the design, the layout, and the attention to detail, because you know, these gardens and the one that we're standing in now are really, really nicely thought through. Each of the gardens are actually themed. The one we're standing in now is designed around sort of sensory ideas, and it's also linked to the physiotherapy department in terms of some of the activities they undertake as part of their treatments.
For us as architects, in trying to give a quality of environment which is less clinical, it performs clinically, but the feel of it is less clinical. And that, I think, in some degree, and we've gone a small way to do that. And from this point on, it's really about the staff and how they use the building and engage with their patients, and hopefully provide a level of well-being to the community.
The hospital is easily accessible by public transport and complements the residential area where it's located. Above all, it is providing modern, comprehensive health facilities on the doorstep for the people of Redcar.